Hi, everyone. My name is Kristen. I am a therapeutic education manager with Recordati Rare Disease, and we are here today to talk to you about living with and understanding cold agglutinin disease. Our presentation today will be on CAD, the science behind what causes it, some of the symptoms that you might see with CAD, potential risks and complications, and then we'll go over some resources that will be available to you to help manage that CAD. So we're going to cover a lot today, but we're going to talk about the immune system. We're going to talk about cold agglutinin disease, again, abbreviated as CAD, how CAD works, look at some of the symptoms of CAD, a deeper look at some of the common symptoms of CAD, some of the complications that you might see or might encounter, and then a few tips and resources for managing. So let's dive in. The immune system is the body's first line of defense. It really helps protect us from getting sick and it promotes healing when we are unwell or injured. It's a large network of organs, white blood cells. It also includes proteins and chemicals that work together to help protect us from germs and other invaders. It can also differentiate between what part of our own body and what is not part of our own body. And as you may have heard, it creates antibodies, which are proteins that attach to foreign invaders and then they mark them to be destroyed. The immune system is a network that works together to protect our body, as we just mentioned. Part of that network is called the complement system. Now, that's a group of proteins that acts as a special force of your immune system, and it helps defend against foreign invaders such as bacteria and viruses that might make you sick. Your complement system activates proteins that work with your immune system to keep you healthy. So, when the complement system is activated, it helps do a couple of things. It targets foreign invaders, it activates inflammatory cells to trap invaders and prevent infection. And it also removes foreign invaders from your body by activating a chain of events. So now that we talked about the immune system and the complement system, let's talk specifically about CAD. CAD is a rare disease. It's a form of complement dependent hemolytic anemia in which the complement system mistakenly attacks and destroys red blood cells. Now, those red blood cells are responsible for bringing oxygen to tissues in the body. As you're probably aware, because it's such a rare disease, information about CAD can really be difficult to come by. There's an estimated about 5,000 people in the United States living with CAD. So people who are diagnosed with CAD, when they have no other underlying illnesses such as viral infections or cancer, that's when they can get that diagnosis. And a common misconception is that CAD only affects people living in cold weather. That's why doctors may tell CAD patients to move to a warmer climate. But now we know that CAD affects people year round and regardless of where they live, although cold environments can certainly trigger symptoms. We're here to provide information that can kind of help you get more learning about CAD and to help become comfortable continuing that conversation with your healthcare provider. So let's move into more specific material regarding what is happening in the body when you have CAD. We're going to talk about what's happening in the body, that complement activation and hemolysis, some inflammation, we'll talk a little bit about that, and then the body system interaction with CAD. So we talked about our immune system. They're meant to help us fight infection. Let's talk about cold agglutinin disease. When you're living with cold agglutinin disease, certain immune cells in your body create autoantibodies, and those are called cold agglutinins. An autoantibody is an antibody you produce that mistakenly targets something that belongs in your body and marks it for destruction. In CAD, these autoantibodies, or again, cold agglutinins is what we can refer to them as, are most active at temperatures that are colder than our core body temperature. This explains why cold environments can trigger some symptoms of CAD. When cold agglutinins attach to the red blood cells, they mark them to be destroyed. As we just saw, once they are attached, those cold agglutinins drag red blood cells together into clumps. Now that's called agglutination. Binding of the cold agglutinins to red blood cells also activates that complement pathway, the part of your immune system we discussed earlier that protects your body against foreign invaders. This activation results in ongoing constant destruction of those red blood cells because the body now thinks they're foreign threats. That destruction is called hemolysis. Even though you might not be continuously exposed to the cold, the ongoing hemolysis happening in the body can lead to complications such as anemia. Now, anemia occurs when you do not have enough red blood cells or when your red blood cells simply don't function properly. When you have CAD and red blood cells are destroyed prematurely, they're not able to do their job of carrying oxygen throughout your body. If your organs and tissues don't get enough oxygen, they simply can't function normally, which could make you feel really tired, and we'll talk about that in just a little bit. That process that leads to that agglutination, the complement activation, and the symptoms they create are important because they're difficult to see from the outside. So it oftentimes sometimes can feel kind of silent in that aspect. Now let's take a look at agglutination and the complement activation. The cold agglutinin antibodies mistake healthy red blood cells as a threat and bind to them. We just talked about that. This is the beginning of the agglutination process in which cells and antibodies cause the red blood cells to clump together. Now, one thing to note is that agglutination occurs at cooler temperatures, often your extremities, where your temperature of the environment is lower than your core body temperature of approximately 98.6 degrees Fahrenheit. It can become difficult for those clumped red blood cells to move through the blood vessels in your periphery because the vessels may be quite small in that area. This agglutination causes some CAD symptoms, such as in the hands, the feet, you can see in the ears, the nose, sometimes turning blue when they get cold. And it is important to note that not all people with CAD suffer from cold-induced symptoms such as these. So let's look a little bit deeper into the complement activation and the hemolysis caused by those cold agglutinins binding to the red blood cells. So in addition to the agglutination that we just talked about, binding of the cold agglutinins to red blood cells also activates the complement pathway. So how does this happen? What happens here? When the cold agglutinins bind to the red blood cells, it acts kind of as a flag for the complement pathway. The complement pathway is then activated by a protein called C1 that binds to the red blood cell that is attached to the cold agglutinin. And you can see it in that picture there. This leads to a complex chain of events that marks that red blood cell for destruction. Now, throughout the pathway, the marked cell is destroyed. Again, that destruction of that red blood cell is called hemolysis. And the important thing to understand is that in people with CAD, cold agglutinins are constantly circulating throughout the body. This means complement activation and hemolysis are happening all the time. Episodes can happen in which CAD is destroying red blood cells faster than the body can even make them, resulting in sometimes severe anemia and fatigue. So in addition to hemolysis, continuous activation of complement proteins, it does two things. So one, it directly triggers inflammation. And two, it activates other cells of the immune system that also contribute to inflammation. So although these complement proteins act as the special forces of our immune system, they also can create a lot of inflammation in our bodies. Now, this constant around the clock inflammation may contribute to that profound fatigue oftentimes CAD patients can feel. So even though we know that continuous complement activation causes that constant hemolysis and inflammation in CAD, complement activation may affect other body mechanisms that can have potentially severe consequences. As we discussed earlier, continuous activation of the complement proteins and immune cells contributes to that around the clock inflammation in the body that causes that profound fatigue. But continuous activation of the complement proteins can contribute to the pathways that increase the risk of blood clotting and can enhance the clumping of platelets known as aggregation. So we've talked about CAD within the body. Let's take a look at some of the symptoms that oftentimes patients report with CAD. Again, since CAD is such a rare condition, it can be difficult to kind of really define a typical experience of what's happening with patients with CAD. That's because everybody's experience with CAD is likely to be different. And not everyone will experience all or the same symptoms. The severity of these symptoms can also be different from person to person. For example, a symptom that's very bothersome for one person may be less for another. Now, with that being said, CAD symptoms can be broken down into two types: symptoms caused by the complement activation and symptoms caused by cold, specifically environments cooler than your core body temperature of 98.6 degrees Fahrenheit. Continuous complement activation causes profound fatigue, anemia, which again, that includes not having enough red blood cells to carry oxygen throughout your body, can lead to shortness of breath, yellowing of the skin or eyes, also known as jaundice, and dark urine. Now, jaundice and dark urine occur because there are greater than normal levels of bilirubin in your blood. Bilirubin is the byproduct of broken down red blood cells, and it's formed because of the breakdown of hemoglobin released by that hemolysis. The symptoms triggered by cold can include bluish or reddish discoloration of the skin, also known as acrocyanosis, and decreased blood flow to the fingers and toes, which is known as Raynaud phenomenon. In rare cases, it can also cause net-like patterns or reddish-blue skin discoloration called livedo reticularis, and skin ulcers or skin death in rare severe cases. Now, some people may experience pain or discomfort when they swallow cold foods, cold drinks. They might experience pain when they do that as well. Again, not all patients experience all the same symptoms of CAD or experience them to the same degree, but focusing more on how these symptoms may be linked to CAD, you may be able to come away with a deeper understanding of some of the science behind these CAD symptoms. Now, let's dig into these symptoms in a little bit more detail. Education is truly power as you advocate for yourself. Our purpose is to make sure that you're aware of the evolving research around this disease. So let's first talk about fatigue, which is a complex issue that is caused by multiple different factors. As we discussed earlier, continuous complement activation leads to constant hemolysis. That hemolysis can lead to profound fatigue. Now, persistent inflammation, which results from continuous complement activation, may also play a role in feeling fatigued. But this profound fatigue is the most debilitating symptom for most people with CAD, affecting all aspects of their life and their physical and emotional well-being. It's important to note that the data presented here are from an internet-based study that may be biased towards patients with access to the internet and/or a computer. Unfortunately, other non-visible symptoms of CAD may include anxiety and depression. Now, a retrospective study, meaning they went through the history of a healthcare system's database that compared 384 patients with CAD to 2,789 patients without CAD from 2006 to 2016, was used to find the effect of CAD on mental health. And it found that people with CAD are more likely to suffer from medically induced anxiety and depression. Now, they are also more likely to use prescription medications and to be hospitalized for anxiety and depression-related events. There were some limitations to the study, so no causal association between anxiety and depression and CAD can be drawn. Although the study was adjusted for factors that may confound association between CAD and anxiety and depression, other health-related variables not available in the database could not be evaluated. And the Optum database only covered commercially insured patients, limiting access to results from other coverage populations. And then the analysis relied on medical codes, and there is a potential for misclassification of anxiety and depression using those codes. So those were the limitations of the study. As we discussed, CAD can cause anemia because of chronic hemolysis, the ongoing destruction of those red blood cells, which is set into action by cold agglutinins binding to the red blood cells. If tissues such as your brain, muscles, fingers, toes, and lungs are receiving less oxygen because the body has destroyed more red blood cells than it can replace, then they may not be working as well as they typically do. So, how does anemia cause shortness of breath? Fewer red blood cells means less oxygen. So, the lungs try to compensate by breathing faster. This can lead to shortness of breath. Anemia also causes weakness, as muscles may not be getting the oxygen that they need. This can lead to a general feeling of weakness throughout the body. Now, let's take a look at some of the most common symptoms that can occur due to exposure to cold. As you may have experienced, cold environments can trigger symptoms related to CAD. So, cold-induced agglutination causes acrocyanosis. This is what happens to the nose, the ears, the hands, and the feet when they turn bluish or reddish. And this happens because when cold-induced agglutination of red blood cells occurs in CAD, it can become difficult for the clumped red blood cells to move through the blood vessels. When that impedes blood flow, it causes that bluish reddish discoloration of the skin. There are also cold-induced circulatory symptoms such as Raynaud's phenomenon, in which the spasms of the small blood vessels in your fingers and toes decrease blood flow and delivery of oxygen. Let's look at some potential complications of cold agglutinin disease. And we're going to focus on two areas, hemolytic crisis and the risk of blood clots. Now, because people with cold agglutinin disease experience continuous complement activation and constant hemolysis, they're at risk for hemolytic crises. So, a hemolytic crisis happens when CAD destroys red blood cells faster than the body can make them. This causes severe anemia and fatigue. And they may be triggered with common colds, such as respiratory and digestive tract infections and surgeries. What's important to understand is that hemolytic crises are unpredictable and may happen at any time. A database study of 29 patients diagnosed and treated for CAD from 2000 to 2016 at Stanford Healthcare found that roughly 72% of patients had at least one severe anemia event within the first year of follow-up. They also found that 67% of patients had a severe anemic event within 6 months of receiving drug treatments not specific for CAD. Now, there were some limitations to the study, including the database did not record reasons for loss to follow-up. Some patients with severe anemia at disease onset could not be followed for 1 year or more. Now, given also some limitations, given that the database captured data from the Stanford clinics, this study captured the minimum levels of care for this group of patients with CAD. Because of the constant complement activation and hemolysis happening in people with CAD, they may be at higher risk of developing blood clots in the body. Now, these blood clots can occur in very small blood vessels and in larger ones as well. In a study assessing historical healthcare claims of 425 patients with CAD compared to 4,126 patients without CAD, it was found that patients with CAD were nearly 60% more likely to suffer from blood clots than patients without CAD. The study assessed these patients over a decade, comparing who had been diagnosed with blood clots and the type they encountered. The claims data lacked details on hereditary and acquired risk of blood clots, which could play a role in the occurrence and severity for these patients. Only the first clot of each type was included in the study, so the risk of blood clot may have been underestimated. And selection bias could be a factor, as patients with fewer than 1 year of claims in the system prior to the index data were not included. So additional studies are needed, as we can see, to further understand the risk associated with CAD. Next, we're going to talk about the steps you can take to better navigate conversations with your doctor. So, if you have CAD, you know they can be hard to find resources. Thankfully, you don't have to manage CAD yourself. We'll give you some tips along the way. By showing up to appointments with detailed notes, prepared questions, and a foundational understanding of CAD and the symptoms that are affecting you, you're helping your healthcare team provide you with the best care. It is really critical to pay close attention to how you're feeling and to be in regular contact with your doctor. Here are a few sample questions that might be helpful to ask your doctor at your next visit. So, are there risks of cold agglutinin disease that I should know about? What blood tests should I have done regularly to monitor my condition? And how often should I get those blood tests? What blood counts should we be monitoring? What are some ways I might manage my fatigue? Of course, these questions are just examples. You should write down any of questions that you might have and discuss those with your doctor or your healthcare team. Also, setting goals for your CAD treatment approach and discussing them with your doctor or healthcare team is important to monitoring your process once you all decide on the path going forward. Here are a few things you can do to better manage CAD symptoms. Now, during doctor or hospital visit, you can remind medical staff that IV fluids and blood transfusions must be kept warm before you receive them. And your blood needs to be kept warm after you have it drawn for blood tests. You can provide your blood lab card to lab technicians and other healthcare providers to help ensure your blood is handled properly. A few additional tips to consider: use your test tracker to stay on top of your blood test results. Take your doctor discussion guide to appointments so you're ready with questions. And then keep a journal with notes about your symptoms or any advice your doctor has given you. Your doctor is your best reference for information about CAD and your treatment. As we talked about before, when you have cold agglutinin disease, it's very important to make sure your blood stays warm. You can give this card shown here to your lab technicians and other healthcare providers to help ensure your blood is being handled properly. As we mentioned, CAD is not a cold weather disease. However, it is still things you can do to help manage the cold sensitivity aspect of your condition. That could include all kinds of things like dressing in layers, being cautious around air conditioning, as your symptoms may get worse when exposure to the cold, being prepared by keeping an extra sweater or a scarf, gloves in your car, wearing gloves when you handle cold beverages or reaching into the freezer for, let's say, ice cream at the grocery store. So, hopefully, all these tips have been helpful and something you can keep in mind for the future to help you manage your cab. So, just wanted to thank you very much. We appreciate your time and we hope you found this helpful. Thank you very much.